Up to 37% of medical screenings in people over 70 lead to unnecessary treatments or long-term side effects. And shockingly, 99% of seniors have no idea they're being over-tested. One test on this list alone is linked to 5% of all cancer cases in the US, the same risk as drinking alcohol daily. You won't hear this from your doctor. You won't see it on a billboard. But the science is clear, and today we're uncovering the truth. In this video, 5 medical checkups you should think twice about after 70 and the surprising damage they can do, backed by real research. Now let's get into the first test, why it seems harmless but could quietly ruin your quality of life. It sounds simple enough. A quick, painless scan with no needles, just a readout of how strong your bones are. But after age 70, this test might do more harm than good. The DEXA scan, as it's officially called, is meant to detect osteoporosis. In older adults, especially women, it almost always shows reduced bone density, even when there's no real risk. That's because bone thinning is a natural part of aging, just like gray hair or wrinkles. Yet this normal result often leads to unnecessary prescriptions for bone-strengthening drugs. One common group of medications, called bisphosphonates, promises to prevent fractures, but they come with serious side effects such as jawbone necrosis, throat irritation, and even brittle bones that can break unexpectedly. Worse still, studies show these drugs make almost no difference for mild bone loss in people over 70. One major study tracked more than 1,200 women and found that after 5 years, the fracture risk was reduced by just 0.3%. That's barely a change, while the side effects are all too common. Consider Elaine, a 74-year-old avid gardener. She stayed active, had never fallen, and enjoyed long walks every day. During a routine checkup, her doctor suggested a DEXA scan. It showed slight bone loss, and she was prescribed medication right away. Within a few weeks, Elaine began experiencing sharp chest discomfort and trouble swallowing. The medication was causing inflammation in her esophagus. After stopping the pills, Elaine switched to a more natural strategy. She added light strength training, increased her vitamin D intake, and focused on calcium-rich meals like leafy greens and yogurt. Months later, she felt stronger, had better posture, and never missed a day in her garden. The lesson is clear. If you're over 70 and haven't experienced fractures or frequent falls, focusing on lifestyle may be the smarter choice. According to a 2022 study in Osteoporosis International, things like balance training, strength exercises, and good nutrition can cut fracture risk by more than 20%. Don't let a scan result push you into medication you might not need. Coming up next, a test that could take you from a routine clinic visit to an operating table. Yes, even brain surgery. When older adults start forgetting names or misplacing things more often, the first emotion is usually fear. Fear of dementia, fear of Alzheimer's. And that fear often leads to one suggestion from the doctor: let's get an MRI. But here's the uncomfortable truth. Brain MRIs rarely give the clarity that patients are looking for. These scans show detailed images of the brain's structure, but in people over 70, what they reveal is usually normal age-related change, slight shrinkage, white matter spots, all common and expected. The problem begins when those findings are misinterpreted. What looks alarming on a screen often isn't dangerous at all, but it can spark a wave of anxiety, follow-up tests, and even invasive procedures that offer little to no benefit. A 2021 study published in Neurology Today reviewed over 3,000 brain MRIs from adults aged 70 to 85 who had mild memory complaints. While 86% showed abnormalities, only 3% were linked to conditions that could actually be treated. That means 97% of patients heard there was something wrong when there wasn't. Even more concerning, nearly 12% of those people were sent for invasive procedures like spinal taps or exploratory biopsies based on unclear or incidental MRI findings. Consider Margaret, a 74-year-old retired math teacher. She began forgetting names occasionally and sometimes repeated herself. Her doctor recommended an MRI, which revealed minor white matter changes. No diagnosis was made, but Margaret grew anxious. She withdrew from her book club and even stopped traveling, convinced her memory was failing. When she came in for a full cognitive evaluation, her scores were well within the normal range. We explained that the scan findings were typical for her age and helped her focus on sleep quality, hydration, mental stimulation, and stress reduction. Within a few months, her confidence and memory improved significantly. Unless someone is experiencing serious neurological symptoms such as seizures, sudden personality shifts, or rapid functional decline, a brain MRI is rarely the right first step. A better option is a cognitive screening test. It is quick, affordable, and evaluates key functions like memory, attention, and problem-solving without the emotional toll of vague scan results. Up next is a test you have probably had more than once, and it may be putting millions at risk without them even realizing it. This one ranks high for a reason. The cardiac stress test is one of the most commonly ordered exams for seniors who report feeling a little more tired, slightly winded, or just not quite themselves. The test monitors your heart while you walk on a treadmill or receive medication that mimics exercise. It's designed to detect blocked arteries, but for people over 70, especially those without clear signs of heart disease, this test often leads to more harm than help. The problem lies in accuracy. In older adults, stress tests produce false positives up to 40% of the time. That means the test says there's a heart problem when there really isn't. These false alarms trigger a cascade of follow-up procedures like angiograms, stent placements, and even bypass surgery. A 2017 study published in JAMA Cardiology found that more than half of all stents placed after a stress test were given to patients without clear symptoms or benefits. These patients saw no improvement in survival or quality of life, but they did face higher risks of complications, including bleeding, kidney injury from contrast dye, and extended hospital stays. Here's a real-world example. A 75-year-old man who stayed active by walking daily mentioned to his doctor that he sometimes felt tired when climbing hills. His doctor ordered a stress test just to be cautious. The test results were unclear, so he underwent a heart catheterization. A minor narrowing was found, and a stent was placed. Unfortunately, that night he had a severe reaction to the contrast dye used during the procedure, which caused kidney problems. He ended up spending nearly a week in the hospital and required weeks of follow-up care. Meanwhile, the original fatigue he experienced never improved because it wasn't related to his heart at all. What he really needed was better hydration and more rest between meals. If you're over 70 and not experiencing classic heart symptoms like chest pain during activity, shortness of breath on exertion, or sudden fatigue with light exercise, a stress test may be unnecessary and risky. Instead, consider safer alternatives like a resting EKG, which measures heart rhythm without physical exertion, or a coronary calcium scan, a low radiation test that helps detect plaque buildup. These options provide useful information without pushing you toward risky procedures. Next up, number 2. This one is surprisingly common and might be exposing your body to far more than just test results. Colonoscopy, a procedure using a long camera to examine the colon, is not always a smart choice after age 70 and is rarely recommended past 75 unless specific symptoms are present. As we age, the risks increase. The preparation involves strong laxatives that can cause dehydration, dizziness, or kidney problems. Sedation used during the procedure adds another layer of risk, particularly affecting brain function in older adults. Moreover, the test itself can lead to complications like bleeding, tears in the colon, or irregular heart rhythms caused by sedation. A 2019 study published in JAMA Internal Medicine followed more than 1.3 million Medicare patients over 70. For every 1,000 colonoscopies performed on patients older than 75, only 2 lives were saved, but over 20 experienced serious complications, a 10-to-1 risk-to-benefit ratio. Even when polyps are found, many are small and slow-growing. Removing them in older adults can sometimes cause more harm than simply monitoring. Consider Dana, a 73-year-old grandmother who ran a bakery with her daughter. She had no symptoms, no bleeding, no changes in bowel habits, and no family history of colon cancer. Despite this, her new doctor, fresh out of residency, recommended a screening colonoscopy. During the procedure, a small polyp was removed, and Dana was sent home. That night, she experienced severe abdominal pain and fainted. At the hospital, doctors discovered a bowel perforation. She spent 9 days recovering in the hospital, lost 10 pounds, and has never fully recovered. When we reviewed her history, we found she had 2 clean colonoscopies in the past. There was no medical reason to repeat the procedure. Current guidelines from the U.S. Preventive Services Task Force recommend stopping routine colon cancer screenings at age 75 for most people. For those who are still healthy, stool-based tests like the FIT test, a simple non-invasive test done at home, are often safer. It requires no prep, no sedation, and catches most of the concerning cases. Talk to your doctor about alternatives, because once you're on the colonoscopy path, it can be difficult to step away. And now, we're down to number 1, the most overused, most dangerous, and most harmful test many seniors have likely undergone. The number 1 health checkup to avoid after 70 is the annual full-body CT scan, often promoted in executive health packages or private clinics as a way to catch cancer early. These scans come with a hidden danger. They expose your body to a high dose of ionizing radiation, which poses serious risks for older adults. For those over 70, the chances of undergoing unnecessary follow-up tests, biopsies, or even surgeries because of incidental findings are alarmingly high. And the truth is, there is no evidence that full-body CT scans without any symptoms actually save lives. Each scan delivers between 10 and 20 millisieverts of radiation, about the equivalent of 500 chest X-rays. According to a 2023 study in JAMA Internal Medicine, the growing use of CT scans may now be responsible for up to 5% of all cancers in the United States, putting radiation exposure on par with alcohol as a cancer risk factor. This means that 1 in every 20 cancers could actually be caused by a scan intended to prevent disease. It is a frightening and ironic reality. These scans often detect harmless nodules, calcifications, or cysts that come with normal aging. But once these spots appear on the scan, they raise alarm bells. This leads to more imaging, biopsies, and emotional distress. Medical experts now agree that full-body CT scans should never be used for routine screening in people without symptoms. The American College of Radiology clearly states there is no proven benefit and a high potential for harm. If symptoms like unexplained weight loss, coughing blood, or swelling appear, targeted imaging makes sense. But scanning the entire body without any specific reason is like using a landmine detector in a playground. You might find something, but the damage could be far worse than what you were trying to prevent. A wiser approach is to listen to your body. If you feel well, keep up regular appointments with your primary care doctor and only have tests that are truly necessary. Your time, energy, and health are precious. Do not waste them on fear-driven screenings that might leave you worse off than before. So there you have it. 5 health checkups that might seem helpful but can actually cause harm after 70. Medicine today is powerful, but not perfect. Sometimes less really is more. Always ask yourself what happens next. If the test finds something, if the results are unclear, or if the risks outweigh the benefits, it might be time to pause and reconsider. Now we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your experiences and opinions with us in the comments below. We'd love to hear from you. Thanks for watching.